it's Tim and Gemma from the Mental Health Hour, and we're back again with another mental health moment. This time, we'll be taking a quick look at the COVID-19 pandemic and how it affects all of us and our mental health. So, in episode 18 of the Mental Health Hour, we spoke with Doe Darling about the COVID-19 pandemic here in America, over there in the UK, and how it affects all of us in different ways, whether it be on the job or, just simply our daily lives. So Gemma, taken from that show, what were some good talking points do you think that we went over?
Definitely think, I know Doe mentioned about the work she was doing for the charity Mind, which is over here, a UK-based charity. But certainly the sticking points for me was just how people are affected by this. I know we spoke about children and how they were affected with their daily lives, just getting up, going to school, everything, seeing their friends, how all that was turned upside down. And then how just even the job that you do can be completely affected, how jobs in general can take much longer to do because of having to sanitize things. And then from I know that I mentioned about with my son having cancer, how anything that came through the door, I literally wouldn't allow anything through the door without sanitizing it, and it was causing me a great deal of stress and upset and anxiety and OCD because I was literally making myself ill with it.
Absolutely. And if we forget anything along the way, it could potentially harm somebody else. And there's just so much to always keep thinking about. Have I been exposed? If somebody close to me positive, now the trickle down effect of I have to report it to this person and that person and my job, and then next thing I know, I'm off for 10 days, even though I don't have it. And the whole thing is still so much a part of our lives, and it's crazy. But at the end of the day, we want to keep taking time for ourselves to remember that this will get better, and it will eventually come to an end.
Yeah, definitely.
So at the end of the day, we have to realize that COVID-19 is here to stay. It's going to be here for a while longer, but we do still want to stress that it will get better. My job is still taking precautions, necessary precautions to reduce exposure, and that plays around with finances. I'm going to let Gemma talk about finances here in a minute, but the variants are what I want to touch on. I mean, these variants they just keep coming, and they're going to keep coming, and we're going to have to deal with this for a long time yet, until we can fully get an understanding on how to live with this as part of our lives. Now, coronavirus has always been there, and it takes on different variants every year. So we should remember that COVID-19, that variant in particular, is the one that affected the entire globe. But Gemma, did you want to touch on finances as well?
Yeah, with the finance side of things, there's certainly when there was the lockdowns and things, people, especially that were immunocompromised, had to remain indoors and rely on stuff like indoor shopping, internet shopping, relying on other people to go and get those things. Like myself, I tend to shop around and will go maybe once, twice a week. And you can't do that when you can't go out. So I know for going on in internet shopping, there are certainly here minimum spends to get the delivery, otherwise you can't get a delivery. and that can affect the amount, because we're not getting any extra in, and in some cases people are just not getting any money at all, like self-employed, or depending on the job that they've got, sometimes less, sometimes nothing at all. And a lot of businesses, I'm sure it's worldwide, have closed down because of the strain of all this and redundancies, things like that. And it's just mounting on and on to the amount of people that are needing to rely on, such as benefits. And in most cases, benefits don't pay as much as a wage. And in a lot of cases, they're not actually a livable amount for some people. And to have to rely on internet shopping and then pay your bills as well, it's such a weight to have to deal with. So again, I know we've mentioned it in many of the live shows. What I would highly recommend for all of this is budgeting, financing, and writing things down all the time. It works for everything.
Yeah.
Make a list of what you need, go through everything that you've got, and then look at making like alterations to what you would normally get, I guess, like different brands, things like that. And different kinds of things, so that it can maybe last that little bit longer. Like, do you have a freezer? Can you freeze things?
Not a bad idea.
Yeah, like there's all
Just make
sorts
things last a little.
Yeah, and then if you have a neighbor that you can share, obviously do it carefully. But if, like, say certainly I've done this where I've made a meal and then another neighbor's made a meal, and we've got so that we can buy bigger packages so it lasts longer. But then so that I'm like, say, for example, I made a lasagna and it fed both me and a other household. And then the next day they made, say, for example, a curry. And that was a different meal, but we were buying bigger packages, and it helps out that way as well. And looking after other people that maybe can't get to the shops and things as well, like elderly people or people that have a disability, things like that. And it does help
Helping out your neighbors.
Yeah, definitely, because you don't know what they're going through. You don't know what's behind that closed door, and you don't know what's in here. Like I've said a million times, a smile can hide a million thoughts. And just because someone's smiling doesn't mean that that's what's going on in here. So just in a world where it's very strained right now and very difficult, just, look out for people, reach out to people. And we're very lucky because we have so many different ways to communicate with people.
I just want everybody to remember to take care of themselves during this time. There's a lot going on, a lot of unknown, and a lot of people are still scared. And it really does affect your mental health when you put all this together. Take time to take care of you and keep moving forward. COVID-19 has been around for 2 years now, and we're getting a better handle on it. We really are. Variants are going to keep coming our way, and booster shots and everything of that. But just make sure that you're keeping track of how you're feeling inside, and not just with COVID-19, but how it's affecting you. I want you to make sure that you keep on the right path of mental health as we deal with this. So, wrapping this one up, the COVID-19 pandemic is here to stay. And unfortunately, we're going to have to keep dealing with it until we can get a good grasp on how to live life again around this, make this part of our norm, because I don't personally think it's ever going to go away. Gemma, what do you think?
I doubt it. I mean, we're just going to have to adapt to life with it like we have with other things, because there are many other illnesses, viruses that a long time ago would have done a lot more than they do now, say, to a lot more people. So we're just going to have to, I guess, learn to live life with it in, because it's not going to go away. That's all.
Live life with it, accept it, and make it a part of our daily lives, unfortunately. until we can get a good grasp on how we can combat this.
Mm-hmm.
So that's going to do it for us for another mental health moment. Thanks for joining us. As always, make sure to tune in Wednesdays for the Mental Health Hour on Twitch, 6 p.m. Eastern Standard Time and 3 p.m. Pacific, 11 p.m. across the pond where Gemma is. And Gemma, can you hone us in on the bio links and all that?
Yeah, down below is the bio link and the website details. Don't forget to check those out. And if you haven't already, join the Discord, which is in the link, in the bio link, to find out what's going on, all mental health hour related, and to just be part of a really supportive community. So thank you for watching.